let's go ahead and set our ventilator up, connect it to a gas source, and get started on what we call a pre-use check. So first thing, plug our power cord in. So in a hospital, you're going to want to make sure that this is a red outlet. Here it's just going to be a white outlet because we're in a lab setting. You're going to have an O2 gas source and an air gas source that you want to connect your hoses to. Green is O2, yellow is air. And on our Servo-I, we have our on-off switch on the back. It's behind this little door. We just turn it on. Turn our ventilator around. Okay, and the first thing that comes up is, do you want to start a pre-use check? That's what we're doing here, so we will say yes. And it's going to perform all of these tests and prompt us when it needs us to do something with it. So first thing, connect the test tube between inspiratory outlet and expiratory outlet. So the vent on the bottom has two drawers. And this is the tube we're going to connect. So inspiratory and expiratory outlet, we covered that on the last video when we set up our circuit. Your expiratory and your inspiratory, we're just going to disconnect these momentarily. Again, make sure they stay clean, don't just throw them on the ground. You're going to simply connect this tube, one end to the other. So just a nice little loop. And then we're going to click OK. So it's going to perform all the tests while this tube is connected. You can see our gas supply test has failed. We have our oxygen source turned off at the moment. That's fine. In general, it will say pass, pass, passed. So we'll just watch as it runs through the test. It performs the test. You'll hear it making some noises. That's okay.
The whole test takes about 2 minutes.
So again, we see we have another failed. That's the O2 cell. Because this is an older ventilator and we're not putting this on patients, we have not changed out the O2 cells. That's okay as well. If we were going to be on a patient, of course we would need to get that changed so we can make sure we're giving the proper amount of oxygen. So it gives us a warning on the battery switch test. It says one of the batteries, Servo has several internal batteries that we can change out on the side to make sure if there was any power loss, we could change those and make sure that we have the power we need. Again, we're not putting this on a patient, so no worries there, just click OK. So unplug your power cord and reinsert it. And now it says connect the patient circuit and block the Y. So we're going to take our little hose that we put on before off, and we're going to just reconnect our patient circuit. Now it says block the Y, so that's your patient end. We have our cap on here. If you don't, you can use a gloved hand and cover that, just so you're occluded and no air can come out. And you're going to hear it pressurizing your tubing, checking for leaks, checking the circuit. And then it's going to say, do you want to compensate for compressible volume? This is always yes. So if you have an external alarm system at your hospital, this test is going to check that. Because we don't here, we're going to say no. So your test is done. In general, you will see this all as passed, but again, we covered the few fails that we do have on there. So we just click OK. Do you want to delete patient data and trends and event log? Yes, because we're going to be putting this on a new patient. So these would both say passed, and then you would be ready to apply this to a patient.